Welcome back to Ageless Living, where you learn about all things beauty, all things balance, and all things peace and happiness. So we appreciate you all tuning into the show. We also would like to thank Arizona Laser and Skin, where you can find them at azmdlaser.com. One of our major advertisers on the show, and they provide almost all of the treatments we're going to be talking about today, including some of the natural ones. Some of them you can try at home, and some of them you might want to do under the care of Arizona Laser and Skin. So keep your pen and paper handy, and Dr. Lee is going to be covering some of the different methodologies that you can't do at home to be able to reduce the acne scarring and other types of scars.
Yeah, make sure you stay till we talk about the natural things you do at the kitchen. Your own kitchen, yes.
Absolutely.
So we were talking about the best treatments and the major treatment methodologies of acne scar. So we talked about the lasers, the fillers, and also surgically. Surgically, we can do excisions, which usually is the punch excision. If you have a pitting acne scar that's really, really deep, you can have it surgically removed. You really want to see our doctor to assess the situation before make such kind of a decision. That will actually take the scar out. Then your skin has a chance to kind of heal together. Has a very fine little line instead of a big dent. Okay. So that's an option that's being done. Subcision. Subcision is really interesting. It means some people have those dimples from scar that is so deep, so bothersome, or when they're smiling, it really becomes more obvious because there's there are some fibrous tissue connection there. If we find a way to minimum invasively using just the needles to cut those fiber cords to release that traction, so when you're smiling, it doesn't dimple up those scars. So that's a very, very good treatment for certain situations. Same thing, you want to see your doctor to determine if that's right for you.
So I have a question that's a little bit off the beaten path. Again, TMI. My son was skateboarding, and we told him to put his little helmet on, and he didn't. And he was going downhill, and this was when he was about 3.5. So he's going down a hill, and of course he wiped out at the bottom and hit his cheek, and it was just the impact. It was
the scar.
Yeah, and it wasn't even a scar on the outside. There was nerve damage on the inside. Is there anything can be done for that kind of thing?
Possibly. We'd be happy to take a look, see if it's a fibrous tissue that's actually attaching the skin down so it doesn't move freely. Mm-hmm. It causes, a abnormal unevenness when he moves his face.
Could have been as simple as that. Yep. Okay, good to know.
Injecting steroids is another thing that's well known. It reduces inflammation. That's usually for hypertrophic scars inflamed, it's growing bigger than normal. So that's something, that's established too. Dermabrasion. There are there are different degrees of dermabrasion. This dermabrasion we're talking about is using something like a rotating wire brush, actually literally sand off your top layer of your skin.
Is that the microdermabrasion? Is that what you're different?
There's a micro in front of the dermabrasion. This one is called dermabrasion.
Oh, okay. So it's a bigger.
It is. It's a lot more aggressive. It can be pretty bloody.
Oh wow.
And this is falling out of favor. It's not as popular, because of the newer, better available technology such as laser.
Oh, okay.
This is little less calculated, so the higher risk of causing scar by that.
New scars. Yeah.
Correct.
Okay.
So it's falling out of fashion, but if it's done right, it's a valid option.
Okay.
Chemical peels will actually resurface the skin too. Mm-hmm. It can work well for the right kind of acne scars. And there are all kinds of different chemicals, salicylic acid, there are all kinds of different things. So you definitely want to talk to your doctor, your esthetician who are experienced, who really know how to do this to get the best results. The next one is my favorite, and it's probably your favorite too, Kurt.
Yes.
Microneedling.
Absolutely.
Microneedling is, let's explain it this way. We call it poor man's laser. It's almost like fractional CO2 laser without downtime. You do need to repeat the treatment, but the nice thing is there's no downtime. No downtime, and you can do it as often as you need to. And it not only reduces the scar, actually rejuvenates skin.
And it really does. There's the two. It's exactly what Dr. Lee said. I had in my mind the two reasons that I love the microneedling effects is that I do have some scars, and they actually, what it does is, because scarring, exactly like Dr. Lee was talking about, some areas don't have as much collagen as those around it, so it helps stimulate the collagen growth underneath, so it evens it out. And also their indentions in particular, they even it out by, it's kind of like blowing into a plastic bottle that you have crunched. You blow into it and it blows it back out and it evens it out.
I want to point out a fact. Aging actually makes the scar look more obvious. So if you have some mild acne scars, from teenager time, that wasn't that bad, in 20, 30 years, it may look more obvious. I mean, it may get better. Actually, some scars get better. Some get worse. If they didn't get better, they can get worse. Why is that? Because after age 30, 35, we lose 1% of the dermal collagen every year.
Oh, really?
And that's why we age. That's how we age. It's
Yeah,
just
good point.
quantitatively we put it into this
You live to be
number
130, then you'll have none left.
Well, you'll lose 70% of it, 65% of it.
But that's why when
And
we
that's
live
why
to
we
be
get
100, we look pretty
wrinkled.
wrinkled. Yeah.
Yeah, and there, basically, actually after age 25, 30, we're not making any new collagen.
Oh.
It's, especially if you have the kind of sun we get, like in Arizona, you're losing a lot more than 1%. This is, on average in different kind of weather. So, to stimulate, to make yourself produce more collagen, there are tricks. The lasers, the needling, and other treatments will stimulate the collagen
Absolutely.
to grow.
So it evens it out, and it also, I mean, I've had some magical results from it. It actually changes color in a good way from the microneedling, meaning that it evens out the coloring on it. So I've been really impressed.
Why do you think that happens?
I don't know. I was listening earlier to what you were saying about with the acne scarring, and this was on my back. It was a surgery scar, but help me.
Absolutely.
Understand that.
First of all, the microneedling itself, the needle injury causes a signal for the body to say, "Why you produce more collagen because I'm injured? You better repair." So that's how it helps with the dimpling and pitting, those unevenness of the scar. It also causes opening or channel for infusing nutrition.
Oh.
So if you were to using vitamin C for blanching, for fading the color, 2% of it would be absorbed over the skin, normal skin. But if you were to do it in combination with the microneedling, over 90% is absorbed.
Wow.
So the results of your product, which needs to be medical grade, not just anything you can use with the microneedling, because you're infusing it, you're injecting it.
Right.
Almost like injection instead of applying on the skin, needs to be medical grade. But the results are much better too.
Very good. So collagen, and what about hyaluronic acid?
Absolutely.
Okay.
We also use growth factor in combination with vitamins, coenzyme, and collagen and hyaluronic acid. So after a real aggressive treatment, you would look glowing, look good. It's a great treatment for going through something important.
Yeah,
like
it
weight.
makes you look younger. That was the third effect, is that, you might be treating your acne scars and making your scars look better, but overall, you just start looking younger too.
It actually can help with the pigmentation too.
Yeah, this is great.
So, melasma can
Mhm.
actually improve too. So,
Very good.
that's one of the things a lot of people are interested in, improving the pigmentation or melasma. Microneedling. Also, we kind of forgot to mention about microdermabrasion. Microdermabrasion has gotten pretty popular because it's pampering. It's
It
not
is pampering.
painful.
It feels good. It actually
It's
feels
not
good.
painful. It doesn't give you any downtime. It makes your skin feel so soft and so smooth. It uses a diamond tip head or crystal type. I prefer the diamond tip
Okay.
because it's so clean and not messy.
Sure.
And it's gotten pretty popular too, this type.
Great.
It also uses a vacuum, so it cleans out the black heads and white heads.
Oh.
So kind of prevents acne anyways, helps to prevent it. If you do enough of them consistently, since it's enjoyable,
Mhm.
it will file down the acne scars too, without the aggressiveness of brutal dermabrasion.
Well, I can see that.
Yeah,
Very good.
so microdermabrasion is a conservative and nice choice for that too. Depending on the parts of the body that you have scars, some people will actually consider stretch marks as scar too. So there's another treatment that's really good for it, and we're going to talk about that when we come back. Some scars on the body parts. And we're also going to talk about some things you can do at home to help with the scar or pigmentation that's in the scar. So don't go far away. We'll be right back. This is Dr. Tong Li with the Ageless Living at voiceamerica.com, Voice America World Talk Radio.
We'll be right back after the break.